Hi, I'm Dr. Melissa Bickett, orthopedic surgeon at Mercy Medical Center. Let's talk about injuries that occur while playing sports or exercising. Sports injuries generally are the result of an accident, poor training practices, improper protective gear, not being in good condition physically, or not using good warm-up and cool-down techniques. The best way to avoid sports injuries is to prevent them as much as possible. Here are strategies to help. Do warm-up exercises before you exercise or play any sport. Don't overdo it. Gradually build up to harder workouts and know your body's limits. Be careful if you're a weekend warrior, that person who tries to do a week's worth of activities in just a day or two. Strive for a total body workout of cardiovascular, strength training, and flexibility exercises. If you're playing sports, use proper form and the right safety gear. Wear shoes that fit properly, are stable and absorb shock. When you run, use the softest, most level exercise surface you can find. When jumping, land with your knees bent. Remember to cool down after a hard workout of any kind. However, even the most conscientious person can get injured while playing sports or exercising. Sprains and strains are common. Other injuries include shin splints, damage to the knee, shoulder, or other joint, Achilles tendon ruptures, and fractures and dislocations. Depending on the location and severity of a sports injury, you may experience some of the following symptoms: sudden, severe pain, pain when you play a sport or exercise, a dull ache when you rest, swelling, not being able to place weight on a leg, knee, ankle, or foot, tenderness in the affected area, not being able to move a joint as normal, extreme leg or arm weakness, a bone or joint that is visibly out of place. Never try to work through the pain of a sports injury. Stop playing or exercising when you feel pain. Otherwise, you will cause more harm. Some injuries should be seen by a doctor right away. Those include an injury that causes severe pain, swelling, or numbness, when you can't put any weight on the area, when an old injury hurts, aches, or swells, or when a joint doesn't feel normal or stable. Other injuries you can treat yourself. You can remember a helpful approach with the acronym RICE. It stands for rest, ice, compression, and elevation. You can also use over-the-counter pain medications and topical creams. However, if the pain or other symptoms get worse, or if self-treatment doesn't work after a reasonable period of time, see a doctor. A doctor may provide an immobilizer for the area to keep you from moving it or causing more damage. Also, he or she may prescribe physical therapy. Mercy offers several physical therapy locations in the area. Learn more by visiting cantonmercy.org/therapy. Most sports injuries don't require surgery. However, in some cases, it's necessary to fix torn tendons or ligaments or put broken bones back into place. You can find a list of highly qualified orthopedic surgeons and physicians on Mercy's website at cantonmercy.org/orthopedics. Following surgery, rest and rehabilitation are necessary to gradually return the injured area to normal. So remember, the best approach to sports injuries is prevention. However, if you do get injured, practice appropriate self-care and know when to see a doctor who's knowledgeable and dedicated to helping you return to play as safely and quickly as possible.